I don't think we have a microphone from the floor, but if you'll speak up, I think we can do it that way.
Dr. Paul, I'm in healthcare and I like what you're saying. My question for you is, if I give you my vote or even some of my time for your campaign, what are you going to do when you get into office that makes your voice heard when it feels like our voice isn't heard right now?
You may not win every legislative battle. I mean, the Republicans are winning no battles right now. But I think that's why the way you grow your movement and the way you become a majority party is by being loud, by being vocal, by being on television and talking about our ideas, articulating our ideas. Obama won because he could articulate his ideas or whatever change meant, but he sounded good when he did it. We need people like that that can present our message, but we also need to stick to our guns. We need to be forthright. We need to present our message clearly, but we need to stay with it and not, as soon as you get up there, just do anything and go along with everything. And that's where we've gotten in trouble. I mean, the Medicare prescription drug plan's a disaster, but it was passed by Republicans. We don't have the money for it. Medicare is short of money because of demographics. There are more older people now than there used to be, and less young people working. The demographics aren't working. So it's disingenuous of them to say, oh, $874 billion Bacchus bill, public option, is not going to cost anything. They're kind of telling stuff that's not true, so we need to point it out, stick to our guns, articulate our message enough to bring people that we can get new people in office. I mean, we need to retain this Senate seat. It's in Republican hands, but we need more. And if I'm able to win this seat, I will help others to win the seat. David and I are already, David's got me organized to help a state senator, Jimmy Higdon, running over in Bardstown area. We're going to do a fundraiser for him in 2 weeks. We want to help to grow the party, but we want to do it by adhering to the platform and not by saying, oh, let's just be like the Democrats. Let's be the Democrats light, and that way we'll get people to like us. I say our ideas are good. Let's articulate them and stand by them.
I wanted to make a comment that as I'm approaching retirement, I have found out that, well, no, now it looks like it's going to be 20 years. But I find that if I do not sign up for Medicare once I do retire and wish to stay with a private insurance company, that I forfeit my Social Security payments. And furthermore, that if I have received any Social Security payments, that my bank account will be garnished to refund the government any Social Security payment. This is passed under George Bush. I don't know if a lot of you know about this, but I did want to call your attention to, and everyone's attention to, the fact that there is a lawsuit that is going on to sue the government about the constitutionality of forcing senior citizens into the Medicare program by force and coercion, and that if you would like to learn more about it, you could contact the Cato Institute, because on a personal note, Ed Crane who is the CEO of the Cato Institute, did support this, and I'm sure that you can contact them and find out who these people are if you would like to support their campaign to win that.
And there's a Lexington attorney involved, correct?
Yes, I think that's correct.
Kent Masterson Brown is from Lexington, and I think he's the attorney on this.
I'm sorry for my English not good enough. When you talk about cost on insurance, I believe it's a priority. Everybody can buy medical insurance. When I came to this country 18 years ago, I started making $5.50, and we spent $380 a month for family insurance. Here it's priority. Somebody wants medical insurance, somebody wants 46-inch TV. Somebody wants it's true. Somebody wants to go in a bar and have drink and watch ball game. Somebody wants to take care of his family. It's my opinion. And second, I believe it's not fair. Cuba. You can compare England, Germany, France to the United States. This will be fair. Because all dictators not go to Europe, they came to the United States. And all people who have money not go to Europe, they came to the United States. One example, former President Azerbaijan, Gaydar Aliyev, in the Cleveland. He not went to Britain, or Canada, or France, or Germany. He came to the United States.
Very
it's
good
the best
point.
medical insurance or medical care in the entire world.
Very good point. Very good. of the things about comparing us to either Canada or Europe are waiting lines. In Canada, at any point in time, over 1 million people are waiting in line. There's a small town in Canada that has one family doctor, and they have a lottery to determine when you get in to see them. If you are high in the lottery, it might be 6 or 7 months. If you're low in the lottery, it could be 3 years. Eye surgeons in Canada finish their allotment by October, and they just come for 2 months, and some of them come down here and have a license down here and do surgery here for 2 months so they can go back and start over their allotment of eye surgeries. It's a crazy system. In England, they have a NICE commission, sort of inappropriately named, but it has determined how much you're worth in the last 6 months of your life. And it's like it's an exact amount. It's $26,000, and if your chemotherapy costs more than that, you don't get it. All government programs, because they're free, get overutilized, and they're always short of money. They're not free because you pay higher taxes in Europe and Canada. They get overutilized, meaning everybody goes all the time because there's not a disincentive to go, you don't pay. And because of that, they're short of money, and so then they have to have, they call it cost controls, but if it's your health care, it's rationing. They ration what they can give out because there's not enough money. We already are short of money in Medicare in this country. Every year there's a pinch on whether or not to cut doctors' fees again. My fees are half of what they were 15 years ago. Every year there's more pressure to cut, but this is without 46 million more people they're going to add to the system. It cannot be done. They cannot do it without adding to the deficit. You will either add more in prices to your premiums or more in taxes.
Dr. Paul, do you believe the tort reform idea is legitimate as far as the healthcare debate?
Yes, and I think tort reform should be part of it. I think, though, it has to be done in Frankfurt, not Washington. If you get sued as a doctor, they sue you in state court. State court is under state jurisdiction. Federal court is under Congress. So I don't know that you can stop lawsuits or do anything to them in Washington. It really needs to be done in Frankfurt. But there are egregious examples. John Edwards made $100 million suing doctors over cerebral palsy, and there's not any medical evidence that has anything to do with the birthing process. You can have a 20-minute delivery, perfect delivery, no problems, and the baby can have profound cerebral palsy, or you could have a difficult delivery. They only sue when you have a difficult delivery, and then they tell you, oh, the doctor should have done a C-section, that's why the baby has cerebral palsy. It's a sad state when it happens, but there's once again a private way to help those individuals. We should have some sort of no-fault insurance that when you become pregnant, you go for your first prenatal visit, and for $25 you could probably get insurance. Because so many people would buy it, because everybody would fear that, but it's maybe 1 in 100,000 babies has a profound neurologic disorder, but then we wouldn't just sort of be pointing fingers. There are doctors in my town who pay $100,000 for malpractice insurance, OBs.
What is your thought, and what do you do in your practice on the Advantage Care plans? I know I have doctors, I have emphysema, and my pulmonologist won't even accept Advantage Care.
Yeah, I do take it, and I think it is just another product, and we should allow more products. But that's the way the Democrats are supposedly saving money, is they're going to end Advantage Care, which patients have chosen because I guess there must be benefits that patients see to it, either an expense or whatever. And it does pay, I think, doctors a little bit less, but the trade-off is like any HMO. Like, let's say I want to deal with Humana or not, but Humana's got 5,000 people in my city, so I make a deal with them and I say, yeah, I'll take Humana for a slightly lower rate. And that is a bit of a marketplace. I think it's imperfect, but the Democrats are going to get rid of those programs. The Democrats, and I'm going to just say something strong, the Democrats hate individual responsibility. They don't want health savings accounts. They despise health savings accounts. They despise things like Medicare Advantage, which have some patient choice involved. They think you're too stupid to take care of yourselves, and that Big Brother needs to do it for you, and you need the all-encompassing Big Brother. And that's the difference between the parties. We may need to make it a stark difference and present it to the public. Exactly.
I kind of briefly to a good question. I have an HSA, and I agree with what you're saying about how it brings consumerism into healthcare. But a big thing that the mainstream media says about HSAs is that it discourages preventive care, and it's just a tax shelter for the rich. If someone from the mainstream media, like MSNBC, were asking you that question, how would you defend HSAs?
What I would say